Here's the real question. How do dentists like you, who aren't willing to let insurance dictate how you will run your practice, who want to create incredibly profitable practices without sacrificing your time or sanity, how do you create the strategies to ensure your practice not only survives, but thrives in the 21st century? That's the blaring question, and Dr. Steve Schalintz is here to provide the answers. Welcome to Dental Practice Freedom Radio.
Hey, what's up, everybody? This is Dr. Steve Schalintz, and I want to welcome you back to another episode of Dental Practice Freedom Radio. I was thinking about what I wanted to talk about, and the last couple months have been crazy for me in a lot of ways. And I was thinking, how do I relate this to my listeners to help them to actually do more of the dentistry that they want to be doing? So it's a very, very common theme from the dentists that I talk to that, you guys know if you listen to any of these podcast episodes that one of the biggest things that I try to help dentists understand and do is do more of their comprehensive dentistry, more of their technical training. And I was trying to think of a way to relate this to help you. And I always remember a quote from Dr. L.D. Pankey. So if you guys don't know anything about L.D. Pankey or the Pankey Institute, basically one of the geniuses in relationship-based dentistry. And he just saw stuff that most people didn't see. And he was a dentist back, I think he started in the 1930s. And he was thinking about comprehensive dentistry and treating the whole person and the mouth way before that was ever in vogue, right? Amalgam was revolutionary back then. And so this guy was thinking about comprehensive dentistry and how to be able to deliver the best care to his patients. And if you guys ever read the book, where is it? I want to make sure I got the title right. Oh, gosh, where is it? I can't find it. Basically, it's a practice of the philosophy of dentistry by L.D. Pankey. And it's just a phenomenal book. The first section of it was written by him, and it's kind of an autobiography, and it's just absolutely amazing. But I'm getting off topic. So getting back on topic, one of the questions that gets asked to me is how do patients say yes and why do they say yes? And so this is going to be a lot of different podcast episodes, and I'm going to be kind of laced through talking about building an expert brand, becoming known as an authority in your community is very important. But there's actually something pretty elemental that not too many dentists even want to talk about. This is not going to be something you hear, I don't think, at a seminar or a conference that you get about case acceptance, but it's really critical. And Dr. Pankey summed it up very well, and I think about it in today's day and age, which is when you need it, this is what Dr. Pankey said, when you need it, they read it. And what he's talking about is if you need financially somebody to accept a case or somebody to do something because your office success depends on it and you need it like right now, the chances of that person saying yes goes down dramatically. Now, I'm not saying it doesn't happen, but for a large case especially, it's just not going to happen as regularly as you'd like. The patient has to be in really bad shape and they have to be self-aware and know that already and know that you're the only person that can help them. And if that's the case, it really doesn't matter what you do, they're going to say yes anyway. And that's actually one of the gifts that I have is I will break down with dentists their new patient process. And it's what I do with my clients. If I'm working with a client one-on-one, I will literally go through and start to break down why somebody would say yes or say no in a given situation. And I'm pretty good at pegging which ones are going to say yes before they ever talk to the dentist based on chief concerns and level of awareness at the initial interview. So I want you to think of a very simple thing and a very simple story as you start to look at doing more comprehensive dentistry. I want you to act like that jock you probably couldn't stand in high school that got any girl he wanted. And you start to look, why did that actually happen? And, you can say, oh, he's a bad boy or whatever. Maybe that's part of it. But I think on a much more essential level, the reason that the jock in high school got all the girls was he exuded confidence and didn't care what the girls thought of him. And you can use that in your dental practice. And I use that more in my dental practice now as a function of time than anything else, and it's actually helped me accept more cases. And you could argue, well, people know that now I teach more, I help dentists more, and so my level of status has already went up in my patients' eyes. So they're more likely to do cases with me now than they were before because I am seen as quote unquote an expert. But I don't think that's really why they say yes. I think on a deeper level, and I don't want you to misconstrue this because it can be misconstrued. I don't not care. I do care a lot. I, unfortunately, though, can't care more about somebody's mouth than they care for their mouth. So that's my standard. Like, if they don't care, I don't care. But I come into a case presentation now from the mindset that I really don't care if they accept the treatment. It doesn't matter to me. The money does not matter to me in any capacity. And when you truly get to that level, and I know a lot of dentists say, oh, I don't care about the money, but yet they operate from scarcity and they do need the money. So it's got to be authentic. It has to be authentically a situation in which you don't care if that patient says yes or no. You're like the jock. He doesn't care if that girl says yes or no when he asks her out or he asks her out on a date because he knows that he's got literally like 10 girls lined up. And he's so confident then, and he's so aloof in some capacity that the girl is going to say yes more often than not because of those extenuating circumstances. So when you go into a case presentation, I want you to be thinking about how can I act more like that? And you don't want to be condescending. You don't want to come off as being aloof, but you can authentically tell a patient, listen, I'm going to tell you what it is I'm seeing and what health in my office. I'm going to tell you what health looks like. I'm going to tell you where you're currently at. I'm going to, talk to you about what's possible. But in the grand scheme of things, you don't have to do any of this. You have to decide what quality of life you want. You want to decide what you want to look like. You want to decide how you're going to be able to chew your food for the rest of your life. You're going to have to make those decisions, not me. I'm just going to tell you the information. And if you say yes, great. If you say no, that's fine too. I don't care. And I'm being serious about that. My only job as a dentist is to give you the information and the clinical judgment that I have, and then you get to make a decision. So my only job is to help you get the information necessary for you to make a good decision for yourself. And as long as I do that, I'm okay. I can sleep at night. It's not going to affect me one way or the other, whether you say yes or no, because that ultimately is up to you. And I've gotten so much better with that over the years that patients say yes more often than not, because I literally am like that jock now. Like, I don't care if you say yes or no. There will be somebody in here tomorrow that is looking for the exact same treatment that you're looking for, and they will probably say yes. And I come at it from that attitude. And I know, some people that are listening to this are going to go, well, that's, you should care about all patients equally. I do. I really do. I all want them to go through the best that I have to offer. But I understand that that's not always going to happen. Right? Financially, they might not be able to afford it. They're not in an emotional place to be able to do it. They just don't want it. They don't value it. All of those factors come into play. But having that attitude has gotten me past that if you need it, they read it thing that goes along with dentistry, and has allowed me to be infinitely more successful in what I'm doing on a daily basis in my practice. So, hopefully you get some value out of that. It's absolutely critical. Just really, really listen to this podcast and try to ask yourself authentically, do I do that? And even if you say, I don't do it for the money, in the back of your mind, on a subconscious level, if you don't, just be really honest with yourself. On a subconscious level, how do I feel about money? How do I feel about my patients? How do I feel about my practice? Am I under stress? Those things will all factor into whether or not somebody will say yes. And I know that's hard. It's a hard pill for dentists to swallow, because we don't want to use that as an excuse for why somebody said yes or no. But there are so many things at play when it comes to case acceptance that, if you don't get this mastered, you're going to be struggling. And so if you do want to learn more about, case acceptance in general, I really have two resources for you. So one is you go to dentalsalessecrets.com, and it'll redirect you to a free webinar that I offer that talks about building brand authority. It talks about being an expert. It talks about increasing your case acceptance drastically. And I would highly recommend you check that out. And I also have the dentalpracticefreedomradio.com. If you go there, you get a free case acceptance master pack. And so between those two resources, you can get a lot of information about case acceptance. and some of the knowledge that I have gathered over the years to be able to help you go where you want to go. So hope you get some value out of those resources. Hope you get some value out of this podcast. As always, if you enjoy it, please leave a review and a rating. That will help me immensely. I really want to put some effort into this podcast and have it continue to grow so we can reach more people, get the message out that, practice freedom is just a few decisions away. You just have to make those decisions. You have to say, I'm ready to do this, and I'm not going to let insurance companies and third-party involvement dictate how I want to run my practice. And I can't tell you how unbelievably freeing that is. So keep up the great work. Keep listening. Keep tuning in, and I'll see you at the next episode.
Thank you so much for listening to this episode on Dental Practice Freedom Radio with Dr. Steve Schlitz. We'll see you on the next episode.